a relatively new panel, which is around pandemics and the future, but what to look for in the future. It's actually, it's been such an interesting time the past few years with the challenges, the opportunities that living through this difficult period has enabled. And we'll look forward to a great panel. I have the great pleasure of introducing a colleague, former boss, and a friend, Elias Zerhouni. Elias is a really unique leader in the industry. He's achieved the trifecta, which is senior most leadership positions in academia, in government, and in industry. And in industry, Elias has been both in the big biopharma sphere as well as an entrepreneur, having started 5 companies. Elias, earlier in his career, was awarded the highest order of merit by the French government, the Legion of Honor, which is the highest order of merit for both a civilian or a military individual. It's just quite an amazing career that Elias has had. But his self-professed most challenging accomplishment was, of course, managing me. So with that said, Elias, I will hand it over to you.
Thank you. And I survived that, all those things, plus you. So welcome, everybody. Good morning, good evening for those who are abroad. This panel is really something that Kiran wanted us to do, Andy wanted us to do, because we are facing a revolutionary period, not only from the point of view of pandemics. I mean, this is the first large, big pandemic we've faced in 100 years, but I think it has disturbed a world that was already disturbed in terms of globalization, and we learned a lot from this period of time. So we assembled a panel to A, share their experience and learnings, and B, tell us where the world should go from here. And I've been really privileged and pleased to be able to invite a panel that is quite expert. Julie Gerberding, as you know, was the head of CDC, was also the head of vaccine and at Merck for many years, as well as the patient officer for Merck, and now is the president CEO of the Foundation for NIH. You'll hear more about that. Really pleased to have Kiran join us, the chairperson of Biocon, to give us a perspective from India and industry. Larry Tabak needs no introduction. He's the long-serving deputy director of the NIH, participated in all the activities of NIH during this very tumultuous period, and now is the acting director of the NIH, a good friend. We worked together many years, and I know that his judgment and wisdom will be shared by us with a lot of delight, as well as John Mascola, who most recently was the head of Vaccine Research Center at the NIH, participated very closely in the collaborations, not only with Moderna, where they were the first ones to collaborate and create a vaccine, but with others, as he will say. So with that, I will start by first inviting every member of the panel to spend 2-3 minutes to tell us what are the salient features and elements and experiences that they retained from these 2 years of pandemic. Julie?
Well, thank you, Elias, and thank you everyone for joining this conversation. You know, we're still in the process of dealing with the pandemic, so we can't quite put it in the rearview mirror and talk about what we have, the totality of what we're going to learn. But I think it's fair to say that one of the biggest positive learnings has been the power of science. The fact that there were more than 800 products in various stages of clinical development globally before the end of 2020 just really speaks to the incredible scientific capacity. Now, science has really been on our side as we've struggled to cope. But on the other hand, society's lagging, and we really see that despite what we can do with our science, we are not delivering that science in an equitable way to the people who need it. And we have a long way to go before we really have brought the value of those discoveries and those new products to some of the people who need them the most. So much to learn, not just about how are we better prepared to reduce the lag time to have those helpful countermeasures, but also how can we prepare in advance so that we can more rapidly detect a pandemic and then deploy our resources in a fair way to really reduce the overall global consequences. It's a tall order.
Thank you, Julie. Kiran, you want to give us your perspective from abroad?
Sure, Elias. Great to be on this panel. Just taking off from where Julie ended, I'd like to echo her, comments on the impact of the pandemic on creating various kinds of disruptions and inequities. So, viewing the world from India, I think we saw a lot of vaccine inequity around the world, because I think when everyone was waiting for vaccines, whilst many parts of the world were well served, many others were starved of vaccines. And so we didn't see immunization in an equitable way in the world. Then we also saw a kind of a split between mRNA and non-mRNA vaccinations in the world. And of course, what we also saw were global supply chain disruptions that really impacted manufacturing, availability of raw materials. A lot of the delivery supply chains were broken. So I think we learned a lot about the need to have resilient and complete global networks and supply chains. I think another very important aspect of the pandemic was the role of digital technologies. Because I think what we saw was that digital technologies did allow us to continue to conduct business and work in a remote setting. And of course, we also saw digital technologies help us to deploy vaccines, medicines, diagnostics at massive scale in a way that was never done before. So I think there were positives and negatives. And I think if you put all this together, I think we have much to learn from the pandemic and how we view the future.
Thank you, Kiran. And John, from your perspective, what can we learn?
Thank you very much, Elias. It's a pleasure to be here with this panel. I'll give a few perspectives on the scientific aspects that really facilitated rapid vaccine development, sort of along the lines that Julie mentioned, and also just a little bit about the coordinated U.S. government response related to vaccines. But I think it is well worth re-emphasizing that within a year of the identification of a global pandemic pathogen, a new pathogen, we had a successful vaccine in hand. Not equitably distributed, but we had one in hand that we knew could work. That success was not based on luck, but rather years of scientific preparation. It was based on the foresight to see that other coronaviruses like SARS and MERS had emerged and that other coronaviruses were likely to come. It was based on years of work on structure-based vaccine design to understand how to actually develop a vaccine. It was based on years of investment, both by the public sector and private sector, on new platform technologies, viral vectors, DNA and RNA. And so that all said, had this virus not been in the coronavirus family, had it not been a coronavirus, or if the pandemic had happened a few years earlier, I think it's fair to say the response likely would have been much more slower, and the pandemic would be even more devastating than it is. So that's one lesson learned, and we can talk about that. And then just the other perspective is that on the US government side, Dr. Tabak can talk more broadly about the FNIH response, but on the vaccine side, there was an effort very early to integrate the US government entities, the CDC, the NIH, and BARDA, into one, really in an unprecedented way, into one entity to work quickly together to develop vaccines in a safe and effective manner. And that government entity needed to work very closely with the private sector through public-private partnerships. So that kind of effort, which had never been done before and never been funded at that level before, really helped the early success of vaccine development.
Well, that's a perfect segue to Larry at the NIH and the role of the government agencies, including FDA, and the interactions that you have led and helped to propel forward, which led to the success that John is talking about. So Larry, what was your point of view on all this?
Thank you, Elias, and it's a pleasure to be here with you and the other panelists. I think the last couple of years sort of shows the best of scientific self-assembly. lot of teams spontaneously came together to answer a lot of questions in a timely way. I think for the most part, people were altruistic. They left behind, their individual ambitions. And in the government, we tried to leave behind the bureaucratic conventions of how we're supposed to do things to move in a more rapid way, although certainly, there's always room for additional improvement. John alluded to the fact that we needed a foundation of solid science. The cooperation of different sectors is something that heretofore we had not done really well, and I think we made good strides in that direction. We also learned that we needed, unique project management. In our case at NIH, this was afforded to us by the foundation of NIH. And I think it was more of an industry way of managing projects. But as others have pointed out, despite all of that, inequities really, were not overcome in many instances. And so, although we had the United States government working together in an unprecedented way, and indeed working around the world, still those inequities were not taken into full account, and we have to do better going forward, obviously.
Thank you, Larry. One of the aspects of the pandemic, which was, in my view, a little bit unexpected, is the relationship between what we needed to do as scientists, public health expert, industry, and what the public and the social political system really reacted to in the way that I think shows a tension, an inherent tension between what you need to do during a pandemic or a crisis of global dimension and the impact it has on the economic perspectives for especially the poor, the people who get locked down, they have no income, the political reaction against vaccines or against public health measures, a lot of dislocation at the interface of the two. Is that something that you either felt was a critical aspect of what we need to do better in the future, and how? I'll let Julie, you want to start? I know you've thought about this quite a bit.
So, I have a long tradition of being involved in preparedness for influenza pandemic and various other public health crises. And I think the limits of our imagination in that context were challenged in this pandemic, because we were really facing it as a public health challenge and not recognizing that it was also going to be an economic challenge, and our preparedness needed to embrace that, as well as a national and global security challenge, which we may come back to later. But I think we concentrated on the development of countermeasures, surveillance, public health interventions, and so forth, without recognizing that none of that was going to be very effective if people didn't have the economic support to be able to participate in the recommendations for non-pharmacologic interventions, social distancing, staying at home, etc. So in the future, I think preparedness planning needs to be much more comprehensive than we had anticipated in the past. And we need to incorporate how are we going to help families and schools and governments and institutions and businesses survive the tremendous disruption in the normal operating business of the day, if we expect them to be able to fully cooperate with the recommended mitigation strategies. We're only beginning to understand the ripple effect of the economic hit, and that is in play in many, many parts of the world today. So much more to that story will unfold as we look back and learn from this.
To get a perspective from India, Kiran, you have experienced also a major disruption, dislocation during the surge between what was needed to be done for the pandemic and what the impact has been on the economy of India. Could you comment on that?
Yeah, so I think India, like many parts of the world, has gone through a huge economic crisis in addition to the health crisis. And of course, we realize that across the world, lockdowns are very, very, serious in terms of impacting the economy. So I think a part of that preparedness planning has to be shared knowledge about how do we go about surveillance and planning for any outbreaks. But I think beyond that, Elias, I think there's another point which I'd like to make about vaccine inequity. Let's not forget that, we still haven't seen the back of this pandemic, and we are going to continue to see, new surges of this pandemic with new variants, and we will be seeing new vaccines responding to these new variants. Are we again going to create, an access problem to these new vaccines? And I think that's where we need to look at pandemic preparedness in a much better way, where I really think having global networks that have hubs and spokes in terms of bulk vaccine manufacturing and fill and finish facilities in different parts of the world would actually make us more prepared. Because we saw that in the past, we really had a huge problem of vaccine deployment in an equitable way across the world, because you and I know that many parts of the world, especially Africa, was starved of vaccines for a very long time, as many other parts of the world. India was fortunate because it was self-reliant in terms of vaccine scale and capacity, and we had in-licensed and developed our own vaccines. But you also saw during the pandemic, there was a lot of nationalism and protection in terms of making sure that, the vaccines did not go out of the country. And I know I see Chris here, and we know that at COVAX, we were trying to get as many vaccines as possible, but there were no vaccines available because each one was catering to their own needs. So I think these are the learnings we have to really look at and see how do we fix them going forward.
Thank you, Kiran. John, from your point of view as a scientist trying to do good, what was your reaction to the tension and the opposition of socioeconomic reactions to the science, to the public health measures that you thought and we all thought were necessary without any political interference, which unfortunately did not happen?
Yeah, one of the things I think we learned from all of this is that when scientists are learning in real time, that causes a great deal of unease for the public. They're more used to a situation where the scientific community, the public health community has years to understand something and then come up with kind of clear recommendations. Here we had a brand new virus. In the early days, we didn't even understand how it was transmitted. It took us a while to realize it was mainly an aerosol, or you breathe the air next to you and you get infected. We didn't understand that we had any therapeutics at the beginning. It took some time. So when the public sees recommendations evolving with the science, there is a sense that we sometimes don't really know what we're doing, or that the recommendations don't have merit. And sometimes there are those who take advantage of that. So I don't think there are easy answers to that, but a broader communication effort to explain why we do things, why we're thinking the way we're thinking, and that we will communicate as transparently as we can as we're learning is one of the hard lessons to take forward for the future.
And Larry, from your point of view, you had a central role, the agency, yourself, Francis, and others in coordinating within the government, obviously. And as you experienced, there are always tensions between the political arm that wants to have a certain outcome driven not by science necessarily, but by political requirements, elections, and perceptions of efficiency. And in many ways, I think we've experienced a disconnect in communications, a little bit like what John is saying, where science did not maybe communicate effectively, even though we had probably the best spokesperson for science, Tony Fauci at the NIH. What was your experience? What was your lesson learned from that tension that you probably lived more than any other, because you probably were put between the pressure of the White House, the pressure of HHS, and the pressure of the science world telling you what's right to do, what's not right to do, and all the attacks that you've experienced because of that?
Well, and sadly, some of those attacks persist to this day. I think we have to acknowledge that we live in a very different world right now. We now live in a world that is digitized. We now live in a world where social media amplifies everything for better or for worse. It's not the world that we all grew up in, coming up, the professional careers that we've engaged in. And so when you have the uncertainty that was not unexpected, given the fact that you had a new virus, a new disease, etc., people either seized upon that uncertainty for political gain or seized upon the uncertainty because of their own angst. I think what I take away from this is we need to do a much different approach to communication, where we have to get into communities and build on the local level the trust that is needed, because the format of having the expert speaking in this hyperbolic, hyper amplified social media world isn't sufficient. We have to take this to the local community level as well as a complementary approach to that.
And do you think that we know how to do this, or do we need to do more research on how to do this?
We need to do more research, because we are still trying things empirically, and some things work well. When you have a pre-existing relationship in a community, you have a good chance of succeeding. But if you have the circumstance where you don't have that pre-existing relationship and you're starting from the baseline, we need to understand how to accelerate that, because unfortunately we do not have that luxury in many communities locally or around the United States and certainly around the globe.
One thing that we've observed also is that the healthcare workers, the doctors, the nurses, the health providers were put under, first of all, they were heroic. Many paid with their lives. They were at the front end of this battle at the local level, as you said. And I don't know that we really knew how to help them, frankly, because of both communications as well as difficulties in understanding the evolution of the pandemic and what to do about it. So you remember all of that tension that existed between the health system and the population at the time of maximum surges, which I think also relate to maybe a point that you already made, and that is that budgetary help, rapid budgetary help, pre-position budgetary help is essential. You couldn't have done, I think, what you did with Active, with the FNIH, or what John did with industry partners, Moderna, others, without it really understanding that you need to fill up the pipeline with resources so that people can respond appropriately. Do you have any comments on how to better prepare the healthcare system if we need to for next pandemic?
Obviously, you have to prepare ahead of the fact rather than after the fact. And the rapidity with which resources were made available by the Congress and administered by the administration, I think were key to allowing us to respond as rapidly as we did. But clearly, as you think to the future, you will need more of that, more anticipation of something happening. And I think John mentioned it already. In a sense, we got lucky because this was a virus that we already knew a great deal about because of decades of investment in the basic biology. Had it been some other agent, maybe it would not turn out quite as well.
I have two questions coming from the audience. I'd like to address them before we go to our next phase to say, what would we do going forward that's essential to being better prepared and more performing than we have been? Although I would have to say that the absolute success of science has been remarkable. I mean, this is a landmark, really, to create vaccines in such a short time and countermeasures in such a short time. Chris Wiebacker, who needs no introduction, he was also my boss and Andy's boss for a while, and taught us a lot of wisdom about the industry. He's playing a major role at WHO with COVAX. I think Kiran and Chris were engaged in that effort, also at CEPI. Chris, you had a question.
Yes, thanks, Elias. Great panel. One of the things we saw at COVAX was this global inequity. And, the Munich Security Conference did a simulation of a non-coronavirus with 3 times the mortality of the coronavirus. And you guys are all expert enough to understand what kind of consequences that could have. And it was interesting that this was in a security conference where those who have vaccines have a different position than those who don't, and do you at some point create global conflicts around that? Any thoughts from the group about how do we actually do a better job? During COVAX, we not only saw countries not willing to export vaccines until the domestic population was vaccinated, but even restrictions around stoppers, medical glass, adjuvants. So how do we actually do a better job? As the head of the WHO said, none of us are safe until all of us are safe, but we clearly didn't do a very good job of that. How could we do a better job of that?
Opening it to the panel.
So maybe I'll just take a first shot because I'm sure everyone has something to say. But, Chris, you and I have often talked about creating global supply networks, because I really think we ought to look at that, making sure that there is a rapid response to, needs during a pandemic, of whether it's diagnostics, whether it's therapeutics, or whether it's vaccines. We saw during this pandemic that there was a very delayed response in many, many parts of the world. We need to speed up that response. And I can only see that happen with a huge global effort to create these global supply networks with that hub and spoke approach that I referred to a little earlier on, where you could actually get a couple of hubs of bulk vaccine manufacturing and then get it out to fill and finish in different regions of the world. That's just one example. But I really think that the WHO also has to play a much stronger role in pandemic preparedness and pandemic planning than it has done in the past. And I think strengthening and reinventing that WHO is a very, very important part of going forward.
Julie, you've been, as director of the CDC, involved in responding to SARS, H5N1, and the pandemic preparedness. Would you comment on Chris' question?
Yeah, and I certainly agree with Kiran that strengthening our multilateral organizations, particularly the WHO, is important. That agency is under-empowered, underfunded, and has suffered from a distributed model of leadership that really does not lend itself to crisis management. So that is important, although it's a daunting future unless we really mobilize the countries that are very involved in supporting the WHO and have the power to hopefully help improve its ability to lead a national health threat. But I also think there's very important work to be done in the context of the strategic alliances that exist between governments. For example, the G20 or the G7, when your backyard is experiencing a huge fire is not the time to figure out if you want to share your fire trucks with somebody else's fire. We have to have these agreements ahead of the curve and come to an understanding of how we are going to share resources and preparedness including the ability to have upstream detection and even preemption. One of the really important tools in that regard, I think, in terms of countermeasures is CEPI, because CEPI not only is investing in trying to sort of follow the NIH model of preparing platforms to address the priority pathogens, but also to have products in the freezer through phase 2B at least that would be ready to be modified or potentially deployed if any one of these threats emerges. That kind of global good is something that we all have a stake in. And I think funding these efforts and strengthening them is one of the most important after action steps we can take as we hopefully evolve out of this pandemic. And actually, we shouldn't wait till we've evolved out of the pandemic. That work should be a priority right now.
Well, one thing you said, Larry, and John too, you said that we were lucky this time. What do we need to do to not be lucky next time, but prepared from the scientific point of view? And also because Chris is asking a question about preparedness, technical preparedness, engineering preparedness, not just science, stoppers. And I know Chris was a major supporter of what we call continuous flow manufacturing, which can be scaled up very quickly, but there's not enough research behind it, because the regulatory system does not allow rapid changes in the methodologies of manufacturing vaccines or any other product. So Larry, what do we need to do to not be lucky next time, but prepare?
Well, so we need to make the investments now. We need to make the investments not only in the basic biological sciences, but also into the regulatory sciences. And as you all know, we were able to work quite closely with the FDA during this current pandemic, but we have to extend that beyond getting into some of the areas that you just alluded to. I think the other place where NIH has a role, which we need to enhance, is helping with the capacity building, globally. So what are the subsets of things that we get involved with? We do work with low and middle income countries to help ensure that they have the scientific and technical workforce that's necessary regionally so that they can take advantage of things as they become available. And presumably we should also be investing more in the lower cost vaccine production platforms, in addition to the high cost platforms that we have successfully employed this time. I mean, there are many things. I'm sure John could add to them on the more technical side, of course.
John, what's your view on that?
Yes, sometimes the whole concept of pandemic preparedness and coming up with a global product, as Julie referred to, is so daunting that the community has trouble understanding where to start. But it does start with investment now. And the problem can be broken down into finite pieces. Scientifically, it can be finite. There's a number of virus families that infect people, and we can research them and we can create products. And then if we create products in hand, where do we make them? We can create our manufacturing network, and we can look at the supply chains. So I think we need to break it down in pieces and tackle each of them and push the system by saying we have preparation and the ability to respond regardless of what happens, and we need all of the elements in place to bring that to fruition.
I also think Kiran's view of the distributed network of manufacturing worldwide is really hard to implement with current technologies of manufacturing. And I think there will be a need, I think, worldwide to develop, as Larry said, lighter, faster, scaling up technologies that can be put in place very quickly. Let me stop here and ask Dr. Sanjeev Sinha, who also has a question, to ask his question. Sanjeev?
Yeah, thank you, Professor Elias. Nice to be here. And great panel. My question is, how should the global healthcare community address the possibility of future variants which are as infectious as Omicron, which has been the most infectious variant along with the higher severity, similar to Delta variants? Any thoughts in terms of prevention and preparedness? Thank you.
Well, that's a great question for John, I think. Beyond Omicron, by the way, more than Omicron, because there are other circulating viruses. So, John?
I would start by saying that it's important to remember we have therapeutics and vaccines that work even for the current variants. So even against Omicron, the vaccines protect against hospitalization and death. The therapeutics we have, the antivirals and the monoclonal antibodies work. So what do we need to do to be prepared? We need data to tell us if we can do better than we're doing right now. Will a bivalent vaccine do better? Those data are emerging. But we have to realize that all of that comes at a cost. We have vaccines and therapeutics in hand. If we change them, we need to distribute them and make them available. So perfection is sometimes not the goal if we have things at hand that can work. The goal is more access.
Thank you.
Thank you. Let me go to the next phase, if I may, because we have about 8 minutes left, and go around the table and ask you the following question. If you were with God that could make things happen, and you had 2 minutes to ask God to do something for you, what would be the things you would want most for the world of the future? Julie?
Well, I would start with an area that I think is not getting enough attention, and that is to really understand the concept of spillover. And by what I mean by that is the intersection between humans and animals that result in new viruses emerging in people, and sometimes new viruses appearing in animals, as we've seen with the coronavirus moving back into new animal species and potentially evolving further there. That's a complicated interface science, and it involves not only understanding the kind of ecological determinants of a spillover, including human animal behavior, urbanization, incursion, and climate change, but it also involves at a molecular level what allows a virus to adapt and be infectious in a new host. So there's a great deal of basic biology there as well as ecological science. And the reason I think that's important is not just because it might help us anticipate targets or approaches to countermeasures, but it will also help us concentrate our detection and surveillance capacities in the places where this is most likely to occur. Our animal surveillance is relatively weak on a global basis, as we've seen in the spillovers that have continued to emerge. So there's a lot of upstream work that doesn't get attention in the middle of a human health catastrophe, but in the long run is an area where science could really pay off. And then the other piece of that we've already discussed, which is to really accelerate the investment and the capability of CEPI so that we have platform technologies, also including what the NIH is already doing. I think, is it 17 families or 27 families or some finite number of families of viruses of pandemic potential, that there's not an infinite set of places to go with this, but to develop those best-in-class platforms. And, we'll probably need a variety of platforms because each virus has its own unique requirements for immunologic response. I think those two things, sort of the macroecologic upstream dimension, and then the preparation and planning for the deployment of countermeasures in an equitable way. But that deployment also has to consider uptake, which is a whole other challenge that we're experiencing. It's not enough to have product. We also have to have trust that the product is useful and will be safe for people to use.
Thank you, Julie. Kiran, you've been at a WHO, you have a global perspective. What would you ask God to do for you?
Well, the one thing that we saw during the pandemic was the huge, devastating impact the pandemic had on the poor. And the kind of devastation we saw in a country like India, where we actually plunged more people into poverty. And yet, I think what was really good about the pandemic was that the government, for the first time, invested a huge amount into beefing up its healthcare infrastructure. And I thought that was a very positive outcome of the pandemic. India as a country has always underinvested in healthcare infrastructure and healthcare spends. And it was during the pandemic that we saw a 5-fold increase in investment in healthcare. And I really hope this continues, because I think if we can take advantage of all that we built during the pandemic in terms of providing extra hospital beds, expanding hospitals, beefing up, human resources around healthcare, the digital technologies and digital backbone that now support healthcare. I think we did a lot, and that has actually led to the National Digital Health Mission in India. So I think if we keep investing this way into healthcare, then India can deliver an equitable healthcare model, the universal healthcare model that we all dream of, because I really believe right to health is such an important fundamental right the world over. And in many, many parts of the world, we just don't have that right. So I for one, really believe that investing in healthcare like we did during the pandemic is something which we need to continue to do.
Thank you, Kiran. John?
Thank you. If I could ask for one thing in addition to investment, it would be ingrained memory, because you can already see a lack of wherewithal with regard to continued interest and investment in not only this pandemic, but the next one. And that's, it's troubling.
Larry?
So I hope that the lessons that we've learned about health disparities and inequities during the pandemic teach us how to redress all health disparities and all health inequities going forward. The things that we did during the pandemic to reach out to communities, to work with them as partners and not as, quote, subjects, we have to expand that to the entire corpus of what NIH does. And I would hope that we were able to do that.
Yeah, thank you, Larry. It seems to me that God is going to respond positively to all your requests. Julie and all of you, God is probably going to ask you, say, how do I do that? Is it time to create a global CDC or for surveillance? Is that something that you would want to do? All of you, what do I do? I mean, you're asking me this. I thought you were going to ask me to eradicate all viruses and get rid of viruses in the world, but that's not something you asked for, so I'm not going to do it. So what do we do next in preparing for surveillance, infrastructure development, manufacturing networks, inequity adjustments, all of that, and health infrastructure preparedness? So one more word, what do you say about an institutional response for the world? What do you recommend?
So the overarching thing I would say is that we have to change our mental model. The most important frame for what we're talking about here is biosecurity. And if we adopt a biosecurity mindset, we will be thinking about this in the same way that we think about the other pillars of our national and global security. We can't just have small scale investments that pop up and go away when the crisis has passed. We need to have sustained investments in assuring that we can protect people's health. That means a sizable increase across the board. It means that leaders in all countries need to regard biosecurity or health security with the same mindset that they think about their national security. And we need to come together. Simple fact that far more people have died from this pandemic than they have from many wars combined. So this is a devastating challenge to the survivability of humans, and we need to approach it at a scale and with a degree of urgency and intensity that has heretofore been lacking.
Kiran, one word, WHO, what do you think? Should it be the vehicle for that?
I think WHO does need to reinvent itself. I think we've discussed this. I think Julie made some very good comments on WHO. But I really believe we need a much closer collaboration and partnerships between CDC, WHO, and many of these institutions that can deliver a lot more than trying to use them as sort of insular behemoths, which never really achieve very much. You need to empower them. They need to reimagine what their mandate is. And I really think we need to invest in these institutions and make them, work the way they should be working.
So, John, should we create a global institute of viral research to address the 22 classes of viruses that we know have pandemic potential, or should we not do that?
I would say yes, if we do it under the biosecurity model that Julie mentioned. So this is not just a scientific effort. This is a national, international effort. And if it's empowered at that level, whether it works through WHO or CEPI or through national agencies like the US CDC and related agencies, it can work. But I think it really needs to be empowered at the highest financial level.
And CEPI could be a good vehicle because they're doing a good job, I would think. Larry, you have the last word.
Well, as you look around the world, there are many troubling signs of, nationalism and so forth. And that was, of course, counter to what we're trying to achieve here. We all appreciate the need for proactive, continued funding, more integrated approach across the globe, yet that runs counter to this sort of nationalism that is springing up. And I fear that unless that geopolitical issue can be addressed, the sort of efforts that we're talking about are not likely to succeed.
Well, thank you all. We're almost a little bit over time, but this was a terrific panel. I think the number of ideas you've generated is worth capturing and perhaps have at the end of the day a USAIC position on advice that we could give to decision makers. I want to thank you. There's a survey, I understand, that will take a minute, and please respond as promptly as possible. And I thank you all for your great participation. I'm very honored to have moderated this panel. Thank you.
Thank you.
Thank you.
Thank you.
Thank you so much, Elias. It's really like, I'm already getting my lot of messages coming on my phone for this panel. So, Andy,